Nurse navigators have such a critical role in the normalization and openness with their patients around sexuality and sexual function. Oftentimes, we are actually more worried about either offending or embarrassing our patients with the question, when in reality, we know from studies that patients are eager for their healthcare providers to ask them about how their sexual life is going, how they feel about their bodies, what's influencing their day-to-day quality of life. And we know that sexuality and sexual function is listed as one of the top 7 main concerns of quality of life issues. We also know that with sexuality and sexual function, many of the side effects don't appear for 2 to 5 years, or some may immediately appear, but as life kind of resumes back to normal, the 2 to 5 year gap is when they start going, wait a minute, this isn't getting back to normal. This isn't changing. And so the effects are longer than many, like dry mouth or fatigue. Those resolve, and yet the sexual function issues remain. So when we think about the opportunities for nurse navigators who are so critically embedded in many steps of cancer survivorship, from diagnosis to treatment to survivorship, there are multiple opportunities to ask about how are you feeling about your sexual health. On a scale of 1 to 10 in the last month, how have you felt about your sexual body? On a scale of 1 to 10, how much has your sexual life changed since your cancer diagnosis? Very simple questions that are not, are you able to get an erection, or are you vaginally dry, right? A very broad question can open up so many beautiful conversations between the nurse and the patient. And so when I'm teaching physicians, nurses, social workers about how to talk about sexual health with patients, I often say, just start with a question that normalizes it. Like, many people report that after their diagnosis, their sexual life changes. Have you had any concerns recently or any questions? Or again, kind of a Likert scale that I gave earlier. There's a model called the explicit model, which stands for permission, limited information, specific suggestions, and intensive therapy. And the X, the EX before the P, means that at every point we interact with a patient, we should be offering them permission to be sexual beings. And so my challenge to my colleagues is, we are constantly asking our patients about, how's your sleep? How's your nausea? How are your bowel movements? Why wouldn't we just ask the question, how satisfied or unsatisfied are you with your sexual health? And as simple as that seems, it doesn't get done. So I think the common place to put in a sexual health question is in our general overall assessments, because what that says to the patient and what it says to their partner is, we care about your sexual health as much as we care about your bowel habits, as much as we care about your pain, as much as we care about your fatigue, and as much as we care about how your kids are being influenced by this diagnosis, we care about your sexual health. 9 times out of 10, when somebody is in the thick of their treatment, they're gonna say, I am not even thinking about that, right? And I think that would be justifiable. They are managing nausea, they feel bad, they're tired, they are achy, their hair is falling out, they don't feel sexy. But by just even normalizing, and what it also offers is the opportunity to talk about intimacy and connectedness. Because oftentimes when sex goes out the window, whether it's sex with self or sex with a partner, touch goes out the window. And so it provides the opportunity when they say, oh my gosh, that's the last thing in my mind, for the nurse, who often, again, has such an incredibly important and intimate relationship with the patient, to say, are you still hugging? Are you still touching? Are you still kissing? Are you still being held? Is your head being rubbed? Are you getting your physical intimacy needs met? And is your partner? So a nurse, especially a nurse navigator, again, who's so integral throughout the process of diagnosis to survivorship, has such a great opportunity in that relationship development to sprinkle questions in multiple areas, whether, again, it's initial assessment, whether it's they've started a new treatment, and we know that radiation is going to affect some of those areas. If it's a new hormone deprivation treatment that we know is going to increase vaginal dryness or decrease libido, that's an opportunity to very, again, normally introduce and give permission, not just for the patient to talk about sexual health by opening that dialogue, but by even just saying that, what you're telling the patient is, you have permission to be a sexual being. And that in and of itself is a gift. The one tool we can do as clinicians is just give patients permission and normalize the impact that cancer and its treatments can have on one's sexual self. The limited information, the specific suggestions, the intensive therapy, the other part of the implicit model will happen with time, and it may not. Somebody may be very well adjusted and adapted, but the pure fact that you took the time to ask and normalize is going to matter to them. And I can say too, for many of the people that I've had a conversation with early in treatment, and they say, Sage, oh my gosh, that is the last thing on my mind. I don't know that I have ever had a patient come back to me or not come back to me 1 to 3 years later, and whether it's email or a phone call or making an appointment saying, remember when you told me that my libido may change or that I might experience vaginal dryness and it may become uncomfortable to have intercourse? Well, I'm experiencing that. What do I do? And because we initiated the conversation early, they knew that we were a safe place to come back to. So from a nursing perspective, you have an incredible opportunity to just open the dialogue, add it to your general checklist, and then if you're worried about you're not going to know what to say, because oftentimes nurses will say, well, if they ask me something I don't know how to respond, what then? Well, we don't always know how to respond, and that's okay. Our patients don't necessarily need us to have all the answers. They need to be given permission, and then when we hear something we don't know, we can come back and say, that's a great question. I don't have the information, but at your next appointment, I'll make sure to get it to you. And having a simple fact sheet on sexual health resources, so things like lubricants, dilator therapy, places they can go. We have some adult stores where I live that the customer service folks are really sensitive to our patients and have conversations with them about what might help them. Being able to give them a booklet like Ann Katz's book, Women, Cancer, Sex, or the American Cancer Society's booklet on sexuality for the man with cancer and his partner, or sexuality for the woman with cancer and her partner. There are resources we can give that we don't have to have the answers. We just need to be able to give them the resources.